Acute care and long-term care health facilities are actively seeking ways to reduce the number of facility-acquired pressure ulcers. Not only is there the strive for clinical benefit, but changes in Medicaid reimbursement policies are driving innovations in clinical practices and materials that help promote better skin health. According to the National Pressure Ulcer Advisory Panel, the prevalence of facility-acquired pressure ulcers can be as much as 18% in acute care settings and as high as 28% in long-term care facility. What's more, the Centers for Medicaid and Medicare Services have estimated that the cost per patient is close to $43,000 to remediate these conditions once they develop. Healthcare practitioners have long known that skin health protocol for limited mobility patients requires effective moisture management. This not only improves the patient's comfort, but significantly reduces the risk of pressure ulcer formation. A recent clinical study was conducted at Cone Health in Greensboro, North Carolina, that showed that moisture-wicking linens can in fact have a significant positive impact on clinical outcomes when used in conjunction with traditional skin health protocols. Most underpads today are designed to protect bed linens and aren't designed to protect the patient. The ThruAir Underpad is made with wick-away material and has been engineered to work specifically with low air loss patient surfaces that are becoming more and more common in state-of-the-art healthcare facilities. Traditional incontinent pads have an impervious backing layer that prevents moisture from migrating through the pad to the linens. This impermeable backing layer prevents air and moisture vapor from passing through the pad and essentially negates the drying effects that are achieved by using low air loss mattresses. Disposable underpads that offer air permeability are often expensive and do not allow air or moisture vapor to pass through once they become wet. They also create problems when they're inadvertently mixed in with reusable linens and get laundered at the laundry. Low air loss patient support surfaces are designed to allow heat and moisture vapor to flow rapidly away from the patient and through the low air loss system. What's critical in the use of these low air loss systems is high moisture vapor transport materials between the patient's skin and the surface of the low air loss mattress. Without high moisture vapor transport rate materials, the flow of moisture vapor and heat is impeded and effectively negates the functionality of the low air loss support system. When one examines the moisture vapor transport rate of traditional bed linen used over a low air loss patient surface, one sees that we're achieving numbers of roughly 700 grams per square centimeter in a 24-hour time period. When a traditional underpad is introduced into that system, the rate of moisture vapor transport is reduced by over 90%. However, when one looks at the moisture vapor transport performance of the ThruAir pad used in conjunction with a traditional fitted sheet, one sees that the overall reduction in moisture vapor transport is a fairly modest 30%, as compared to over 90% reduction with a traditional pad. Bottom line, that means that a ThruAir pad is not going to impede the flow of heat or moisture vapor away from the patient's skin and through the low air loss patient system.